Hello everyone, I'm Dr. Spinach, but unfortunately I failed my PLAB 2 examination in my first attempt in March 2022. I scored 106 and passed 9 stations, but only 105 was required to pass, but I had to pass 10 stations and I lost only by 0.5 scores in one station. Normally when you get PLAB 2, you have to score more than the average required score and pass 10 out of 16 stations. Now, I didn't lose heart and I wrote this exam again in November 2022 after I completed my master's in Brunel University. And this time, fortunately, I passed this examination with 125 scores and I passed 13 stations in total. Now, the question is, what did I do differently? So let me tell step by step. Firstly, let me bust some myths about PLAB 2 examination. People say it's a very easy examination and you can pass it with good interpersonal skills. I don't think that is wholly accurate. Only interpersonal skills are not going to save you. You have to understand that when people say it's an easy examination, you don't put as much efforts as the exam requires you to put, and you lose. PLAB 2 examination is not a piece of cake. You have to prepare for this examination, but you can definitely pass it with good preparation. So remember, efforts are important. About second point, which is the one that attributes to my first point, where I said do not rely on your interpersonal skills. In PLAB 2 examination, the marks are given on 3 domains. These are the data gathering, the interpersonal skills, and the management skills. Now, understand this. Someone who is not a doctor but is sweet but don't know how to treat patient, do you think GMC is going to qualify that person? So just think of it that way, right? After practicing with several candidates, I observed that most of them have very good data gathering skills and interpersonal skills, but they lack on management skills, and that is why we fail. Now, it's important to have a very good layout of a management plan for every condition in PLAB 2, and then remember, you will ace it. Now, repeating again, a very good layout for a management plan is important in PLAB 2. Thirdly, address patients' concerns. You should at least have 3 to 4 minutes of time when you reach the management. This includes explaining the diagnosis, giving further investigations, and a treatment plan. Now, I was really surprised. There were like differences in 2 of my attempts. I was surprised that my patients had so many questions in my second attempt. Why? Because I left them time to ask me questions after I gave them some treatment plan. So remember, you have to have some time frame for them to ask you questions. This is going to increase your marks both in interpersonal skills as well as in management skills. Okay? The fourth point is very, 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 very super duper important. Do not follow any coaching blindly. I'm repeating this again. Do not follow or completely rely on any one coaching blindly. These coachings are not like FMGE or NEET PG coachings in India that nothing comes out of syllabus in our exams. So what you can do is you can have some stuff from one coaching, some from other, some from the third coaching, and develop a unique plan for yourself. So a unique approach for yourself. Remember, in PLAB 2, there is nothing right or wrong. Now, let's say one person, I like to give examination and then give a provisional diagnosis. Someone else might like to do examination and do investigations as well and give a definitive diagnosis. So everyone's approach is different and nothing is right or wrong. Just like every patient, every doctor is different. So remember, Do not rely on one coaching. Have your own logical way of thinking and have your own approach, a unique approach. You have to be you in PLAB 2. The fifth one is ICE. ICE is idea, concerns, and expectations. Now, ICE is not just important for difficult cases or for breaking bad news cases. No, ICE is important in every single case of PLAB 2 examination. Understand this. If you know what is the major concern of the patient and what does the patient expect from you in this consultation, you can actually direct the management plan for the patient in that direction, and you do not have to spit out everything about that management or treatment of that condition. That is an unnecessary information that you do not have to spit out. For example, if major concern of the patient is child's care, when she is admitted, then you have to address that concern first and then come to her IV antibiotics treatment. Finally, the sixth one is time management. In the next video, I'm going to give you some tips on time management. I knew a trick that can actually help you with your time management in PLAB 2, which is actually everyone's issue around in PLAB 2.
So guys, stay tuned!
At the end, I can only say that PLAB 2 is an unpredictable exam, and failing or passing it does not determine your worth as a doctor. If you fail, do not lose hope. If you pass, finally, very important, I'm repeating this again, take this as your FMGE, NEET PG or USMLE exams. This requires efforts, and if you sincerely prepare for it and use some of the advices and tips I've given you in this video, you will definitely gonna pass this exam with perhaps 16 out of 16 stations, who knows. I know a person who actually passed with 16 out of 16. So yes. And finally, I don't have much time these days, but if you want personal feedback or some guidance on PLAB or FMG examinations, you can have or book 1:1 sessions with me using your Instagram. So my Instagram handle is Dr__SPINACH. It's down here. And or you can, if you don't use Instagram, then you can use my email ID, drspinach21@gmail.com. Apart from that, if you like this video, please click on the like button and subscribe to my channel. And if you have any queries, any doubts regarding this exam, you can post it on the comment section below. I will try my best to answer these questions. And well, in the next video, let's talk about time management. Stay tuned, Dr. Spinach. Bye-bye.